I think we'll go ahead and get started today. I know that we have more people that are signing on, but I want to go ahead and get started to make sure that we get this started on time. We're very fortunate today to have one of our business partners with us. I guess I should say, and for those that don't know me, I'm John Bass. I'm the Chief Operating Officer with AESA, and we're so fortunate to have business partners at AESA stepping up to the plate right now to help our members. We have several business partners that have come up with different ways to address the crisis that we're in and be able to share sessions like this with our members. We think it's been invaluable. And so we really appreciate the relationship we have with our business partners that we screen very closely. In order to get to be an AESA business partner, we do a due diligence process with them, make sure that they're top quality before we present them to our members. And today, we're very fortunate to have one of those AESA partners with us in STOPit Solutions. STOPit has been with AESA about a year now, and they've come out with a new product that we want to be able to share with you today, or a fairly new product as it relates to all the things that we're going through right now. I know that as you try to reopen your buildings, as you have schools that are trying to bring kids back into classes, they're doing virtual classes, all these different issues that we've never had before. And we feel very comfortable that one of our business partners, being STOPit, has a good solution to help with that. The session today is on a new product they have, STOPit SafeScreen, which is a COVID-19 health reporting system. And I do want everyone to know that we're doing this a little differently than we have in some past meetings. We're going to have it in meeting mode. So if you would make sure that your microphone is muted, but at a certain point during the event, we will have an opportunity for you to ask questions. We also have a chat function at the bottom of the screen. If you'll move your cursor down to the bottom, you'll see the chat function. If you have questions as we go through this, don't hesitate to go ahead and enter them there, or you can wait till the end and ask them whenever Tim gets to a point that allows that. So either way, we want to make sure that we get your questions answered and try to be as helpful as we can today. From STOPit today, we have Tim Marcus. Mark Macris, make sure I get that right. And if Tim, if I butchered that, help me out with that. We're very glad to have Tim with us. Thank you, Tim, for your partnership. And I'm going to turn it over to you now to talk about STOPit SafeScreen.
You bet. Thanks, John. Really appreciate it. And you got it just fine there in terms of my pronunciation of my name. And thanks again to ASA for the partnership and most certainly helping us set this up to introduce what we believe is a great product that can begin to be used in schools right away with regard to how schools are trying to address the COVID-19 situation. Just real quick, so I'm the CEO at STOPit Solutions. I've been on board since earlier this year and immediately reached out and began partnership with John and the team, and have done a lot of work with ASA in and around the STOP Act that you may have seen, in working with many organizations across the U.S. So we're super proud of that, and we know, again, with this product, there may be some opportunity there as well. For those who didn't get an opportunity to meet me earlier this year, my background is all school. For the past 8 years, I worked with Sandy Hook Promise, where I helped co-found the organization, build out all its curriculum, build out its anonymous reporting system and such, and worked with many of you, quite frankly, in that role in rolling out those programs. And now I set my sights on working with STOPit and rolling those programs out nationally to really have an even greater impact than what we had while I was with the Sandy Hook Promise group. In terms of today, we want to introduce you to the COVID-19 health screener, which we're calling SafeScreen. How does it work? What do you need to get started with the program, and what are the benefits? And talk about the partnership program, what we put together for you and for your schools. As John mentioned, we've been a partner for over a year. We're super proud of that. You folks have been just fantastic on advising and giving us insights to what your needs are and how we can help you as you move through a school year, as you move with particular situations. And you'll see, frankly, starting with this and more to come in the months ahead of new products and ideas that we'll be rolling out that are based on those conversations that we've had with you. For those who are new to STOPit, our organization, we're an ed tech company where we bring together technologies and curriculum together in a complementary fashion to help create inclusive and connected and healthy learning and working environments. We work in K-12, and as reference, we work also in colleges, universities, with government, public safety, as well as workplaces. Our programs, we have 5 core programs now. Our anonymous reporting system, which I hope you're all familiar with, the new Safe Screen, which we're going to talk about today. We have an incident management center, 24/7 management center, where we bring in and assess the incidents that we get and help with the schools in terms of what they do to action against those tips. We have a telephone hotline center, primarily for workplaces and local government health agencies. And then finally, our curriculum center, which is our mental wellness and compliance training center, where we have curriculum to work with the schools in and around SELs, as well as curriculum that complements school safety. So that's who we are. That's what we do. Our impact, we're in 6,000 organizations. We service and support over 4 million students and employees. We've had over 150,000 incidents that have been intervened on, and truly we have helped save lives with our programs. So real quick, that's who we are. A lot of credibility as we now move into this product, and that's our new STOPit Safe Screen, and it's a health reporting system. I'll get into what that means in a few minutes, but I just want to give a little bit of a background as to, okay, why are we doing this, and indirectly, how can this help you? So first of all, we all know schools, businesses, everyone. There's just a lot of challenges out there right now in the world. It's like, how do you protect your students, when they're coming back in from getting infected from others? How are you meeting state requirements and mandates? How are you minimizing, liabilities? As you all know, the liabilities in some states haven't been set up, and on a national basis, it's in the Senate right now in terms of trying to pass better protections for schools and businesses. And then just managing all of this. How do you manage through this? When you look at what's out there right now, you've got the ever famous hand washing, PPEs, social distancing, testing where you can afford to do it. And then some folks are even tracing. We haven't heard much in schools, but tracing is taking place primarily on a manual basis when something happens and you contact your local health district. But that's really all that's going on in this space. The challenge with that, and a lot to read here, but the headline is this, that those things have limitations. In all 5 instances that's currently available to you, people can still come in the building. So you can come in and be infected and wash your hands, use PPE, social distance, etc. So none of them stop the individual from coming in to begin with. Also, it's difficult to maintain and use. So it's hard to know whether people are constantly and consistently wearing their masks and properly wearing their masks, to washing their hands, etc., etc. Testing and tracing, that's expensive. And typically those 2 means are after the fact. Once you've discovered that someone may be exposed or someone may be infected, it's often too late because they're already in the building and they've already had contact with others. And all of these things kind of lack a real-time reporting for you, for schools to be able to track the trends and such that are taking place within their school district. So it kind of leaves a gap as to where are there more prevention types of steps that can be used. And within those steps, where's the better maintenance and how you can do it in a more value add, less expensive manner than some of these others like tracing and testing. And that's where we filled that gap with our Safe Screen. Now, Safe Screen, it's HIPAA compliant. That's very important given the information that we're gathering. But it basically screens and has an individual screen themselves utilizing CDC, NIH guidelines, as well as, you'll hear this again, your own custom questions that you want to put in. And based on those answers, the system will immediately tell the user, hey, you can enter today or you can't enter. By doing that, you're keeping someone who could possibly be infected out of the school, and you're going to be able to assess and take actions before they come in. And like I said earlier, it's too late. Once they're in, then they're going to be possibly exposing other individuals. So that's the greatness about a program like this, is it's truly ahead of all of those other steps. Now, this program is real easy to work. So the first thing that hit us was accessibility. We have to make this easy because this thing needs to turn quickly for schools to take advantage of it. And not everybody has a smartphone and easy access to downloading apps and that sort of thing. So we're a web-based application. So that means any device that connects to the internet will be able to use this. And the beauty of it is it looks like and acts like an app, but it really is a web-based application. How it works is pretty simple. They're just 3 steps to daily usage of this program. The first step is around alerting the user to take the screener and then actually take the screener. So that's step number 1. That piece is a system-generated alert that goes out to a user. So let's give a good case example. It's going to go to a parent, guardian, or caretaker of a student. They're going to get an alert via email and text with a link that's embedded. They hit that link, then they're able to sign in and immediately take the screener, all of maybe 30 seconds, 45 seconds in totality. As mentioned already, the questions they're answering are a combination of, hey, what's your availability status? Are you coming to school today or not? You'll see that in a moment. And these CDC NIH guideline questions that we're utilizing. Then what happens, once they answer those questions, the system immediately assesses those answers and provides, hey, you can enter today, or sorry, you can't enter. Please wait for the school to contact you to follow up on any other actions. And then each day, that pass expires at 11:59 p.m., so they begin the process again the next day, so you get a good read as to the health and well-being of individuals on a daily basis. So this is a visualization of what I just mentioned. So going from left to right, the individual in this case, and I'm using a smartphone, it can be done on a PC, tablet, etc. So on the left-hand side, the individual gets an alert. You see the blue link there, hit that link, go to your sign in with your password. You could, of course, can store that if you'd like, and you could truly get past that in about 5 seconds if you've stored your username and password. Then you get to the home screen. It will tell you, if by chance you forgot, what's your status in terms of an entry pass. In this case, you can see it's expired, the big yellow rectangle. I'll know then to hit New Health Screener. Once I hit New Health Screener, it brings up a series of questions for me to answer. Those questions go from, hey, am I even going to be coming in today? Because we all know, right? Schools are either you're at school, you're at home learning, or maybe you're absent. And we want to be clear as part of this tracking, are you absent because of COVID, or you're absent because of something else? So that availability is a crucial question. Then the following questions are from CDC guidelines, and they have to do with symptoms or your exposure to COVID in and around where you live, in your household, that sort of thing. What's key here is it also allows the opportunity for a school district to add a custom question in order perhaps to meet any local or state regulations, or to change in general the questions that you see here, because maybe the state has a different approach, like Wisconsin, where they have a high-risk questions, low-risk questions. You can customize for them in their particular case. Once you've answered the questions, as I mentioned, then it provides you with an entry pass. The entry pass is for those students who do have a smartphone to be able to show as they come in the front door, or an employee, whether they passed or not. And it's screaming like that with the green and red on purpose, because we want people to know, hey, you can go or you can't go, especially on the do not enter, because perhaps, you may be symptomatic and we don't want to spread this if we can help that. So that is step one of the program. Step two now is, okay, where does that information go and what does the school do with it? So administrators who've been assigned to this program receive their screener results within a database, and it's automatically taking that data in real time and providing where you are in terms of your students. So if you have 100 students, it will immediately tell you if those parents, caretakers, guardians have taken the screener that day and how many are remaining. Then it gives you a quick dashboard as to how many are do not enter, et cetera, et cetera. So in the case of individuals who've been identified as do not enter, those administrators will receive an email or text alert stating, hey, someone has been denied entry, and it instructs them to, of course, follow up, which is, we have yet to find any protocol in the United States that doesn't have a school district calling a student, calling the parents to say what's going on in terms of them not coming in if it's COVID related. So that's a natural step that would take place. The administrator then can contact the individual, so the parent, caretaker, or guardian, and talk to them. And there's two ways they can do that. There's two-way chat within the system if the person wants to do that, and they can pick up the telephone and go old school, if you will, by using the phone and speaking with the parent to get some better insight as to what's going on. Then what the administrators can do is, for those students coming into the school, they can check them in, or they can have the student show their badge, that entry badge, to get in. And then also you could do printouts. So you could get a printout to the school bus if you required them to get their screener done the night before, send it to a school bus driver, provide a printout for administrators to check kids in. There's many different ways that we've built the program for the easiest usage by the school district. So again, let's look at now the visualization of what I just said. So this is all around what happens with a do not enter alert that would come to the administrator. So they would get an email or text on the left-hand side of the screen where you see it says, please sign in. An individual who has completed the assessment was just identified as diagnosed, exposed, or some other symptom. So you want to jump on top of that to see what's going on. They sign in, and then immediately they can go into their users, find that individual, and get the information and begin that two-way chat or to make that phone call. So this is a representation in the middle of the screen of the two-way chat that would go back and forth, or again, you can make the phone call if you so see fit. Thank you. As far as check-in now, if you were to check in, the individual, let's say in the front of the school, could sign in. Then they could go to their user screen and they could look up a name if they chose. So just simply put in the first three letters of their last name, brings the name up, and you can check to make sure that they're safe to attend. Or you could look up using an iPad or PC view. I wanted to show both views. It's the same information on the middle and right-hand side of your screen. It's just showing it using two different types of devices. And of course, you can check in by looking at the entry pass or by simply having a printout and going down the list to see, who is able to come in today and who isn't, if by chance the individual decided to still come to school after getting the do not enter, which of course is extremely low odds that will happen, but nevertheless, we want to have those safeguards in place. So we've now had step one of the individual taking the screener, getting the results. Step two, the administrators being informed and then checking those folks in. Step three is really as needed, and that's looking at the data. And administrators will have 24/7 access to real-time data dashboard that gives you an org-wide view, or if it's for an individual school, an administrator for that school can go in and get a view of what's going on with their population of kids. So at the bottom of the screen, you could see just an example of the dashboards, and you can cut this data, by location, absentee type, user type, whether they're student or their staff, their guests, their contractors. We have many different user types to be able to track that information. And by cutting it that way, you can begin to look at trends. And you may say, wow, we really got to look. Yes, unfortunately, if a school does have someone who has become infected, it is important to look at those trends and directionally see where things are moving so they can proactively get ahead of it. And that's the beauty of these dashboards and the reports that we put together, which we feel, based on other programs that are out there, bar none, as per typical of our program, we always provide great data for you to use for making easy and better informed decisions. So there you have it, 3 simple steps. You got that user getting the alert, them taking the screener. That takes about 45 seconds max for them to do it. They're then informed whether they can enter or not. And then the administrator, is going to check them in. The administrator is going to follow up with anybody who got a do not enter to talk with them about next steps. And then as needed, the administrator can look at what data, what trends are out there, either as an aggregate, their whole district, or for an individual school. Other features the program have is the user can look at their screening history, and then users can also upload, and that will come on September 14th, a doctor's note, test results, proof of vaccination, which is going to become an issue as we go forward with some school districts and such. So we've added that in there in anticipation as to where this is going to go. And of course, you can change usernames. And there's always, again, STOPit in truly their reputation for 24/7, 365 live support is what folks can get from the help if indeed they need it. So what is needed to get this established? So we wanted to make this as simple and as turnkey as possible. So hopefully you'll see that as I'm walking through it. So from a role point of view, you need a lead administrator. You need someone assigned who can manage this program and oversee it for the entire district. It could be 2 people, but traditionally most districts choose 1 person to head it up. In addition, they'll have the option of choosing what we call organization administrators. Those are folks that are in each school, perhaps, that oversee the program. So that they will have autonomy and management at a location within the district. And by the way, this can also be a team of people if that decision is made, or could be a department. So it doesn't have to necessarily be a location, but traditionally it is. And then only on an as-needed basis. If you're checking kids in on the front door, you may need some admins to help check in on a daily basis, super light lift. But it's really those 3 roles, 2 or 3 roles that are needed to get this program on its feet. In terms of setup, here's another place where we've just excelled on understanding how schools work and making it easy. So there, we just simply need a CSV file. So it's basically a data file which has location name, and students' names, which in the case would be parent caretaker name as well, who would respond on behalf of the student, so that we can set the system up so that it automatically sends the information out. Everything is automated once that CSV file is uploaded. The administrator also sets permissions. It takes honestly about 5 to 7 minutes to go through and set these permissions up. But when do they want to send the alerts out to do the screeners each day, that sort of thing. Also, the lead administrator is going to identify for us who the org admins are going to be if they choose to have someone representing, let's say, a school in the management of the program in the school. And I want to keep saying this. Once they do that, the system automatically takes care of the communication out to those individuals. Everything is just set it up and then let our system do the rest of the work for you. And then finally, the system, once you have the users, so that would be the parents, guardians, and caretakers, perhaps the employees of the school district. Once that's uploaded, the system will automatically send out, inform them of the program, and ask them to register because they will have to use a username and password to get in. All of it's automated. All of it truly takes a minimal amount of time, of course, depending on the size of the district. Training. So all of our training is self-directed. It is a very easy program to grasp. We've tested that already in beta testing. And of course, we have 24/7, 365 live support should someone have questions that they can pop in, and our team will be able to help them right on the spot. As mentioned, in entirety, training setup can take anywhere from a day to 7 days, depending on the size of the org. And we're taking into consideration, hey, we have to go and talk to so-and-so, we need to get these names, and then inputting the information. So that's where that comes from. We provide video intros, we've got parent templates, we have other materials for the schools, of course, to use to communicate this out as well. So why SafeScreen? So I'm not going to go through all of them, but from a safety point of view, clearly getting and screening individuals before they enter a building is critical. And you're going to see this in a few pages, but part of this isn't necessarily, boy, I need this now. If a school district doesn't have COVID or any cases going on, some school districts may use it once they have COVID, because now they can better manage. Okay, wait a minute, I had a few students come down with this. We probably should put something in place to make sure this isn't expanding in any way, shape, or form. So that has to do with getting ahead of it, right? Prevention and identifying those individuals before. Of course, protection, being HIPAA compliant is incredibly important. So separating that information from personnel and then utilizing systems that have the highest of security. We use AWS. So we have most certainly the highest of high working with them. And we do not do any GPS tracking in any way, shape, or form within our app. That's very important to know. So a lot of folks don't like that aspect, so we did not build that into our program. From an operational point of view, it's all digital. A lot of school districts out there, and I'm sure you're experiencing this or have heard it, using Google Docs, using sign-in sheets, and other means. It's a lot to manage. What do you do with the paper? How do you know where you stand when you've got 50 pieces of paper for a given class or a given school or 100? How do you decipher where you are as an organization? So keeping it 100% digital most certainly helps schools out. There's no thermometers or purchasing of thermometers because you're stating to the parents, guardians, caretakers, and the employees, you need to do this at home. And if you have a temperature, you should not be coming in. And that is a question within the questions to reinforce the importance of that. Minimal training. The access is, incredibly easy based on how we set it up. And of course, this is very fast. You saw the steps I took you through on those visuals, that those steps take place very, very quickly, truly within seconds. From a legal point of view, you've got compliance to local and state regulations. Many states now are requiring schools to have a screener in place. So this is the opportunity to take advantage of that in a very turnkey way. Also responsibility. I'm sure you saw in the news last week of an individual who went to school knowing he had COVID with the intention of trying to get other people sick. So this puts a lot of responsibility because we ask the questions and we reinforce it. We ask them to confirm what they're submitting is true, and then we ask them again to reconfirm that, so there's no misunderstanding that what you're providing to the best of your knowledge is truthful. And then, of course, protections. And financially, look, we're not out here to be walking to the bank with this program. We're in the middle of a pandemic, so we want to help. There is a cost to our program, but we are going to be discounting it for ASA, but we need to be reasonable just given the budgetary constraints that are going on out there. So again, in typical STOPit fashion, we understand that, and we've priced it accordingly to make sure it's affordable for everyone to use. Most certainly less intensive from a resource point of view, and it is very, very efficient. I want to stress again that there's an opportunity with this program to start voluntarily using it. It's great for sports teams. We have an organization now where they're going to use it for their fall sports teams. And then if something comes up, they'll spread it into the school. So there's an opportunity to kind of ease in. And then, God forbid, if a school is hit with a COVID case, then they can turn it into a more of a strict protocol that they're using. Also, I want to stress this. If people are being truthful and they are displaying these symptoms, and they were perhaps around folks who may have been exposed or had the chance of being exposed to COVID-19, you're going to intervene in 100% of the cases if they're being truthful. And that's why a program like this is so important from a preventive point of view. It's sending the message of we need to protect and we need to prevent before someone has a chance to go from being a single person in their home with their family to walking in and infecting, 100, 200, 300 plus folks. So let's talk a little bit about the ASA program, and then we'll take your questions. First and foremost, in continuing our tradition of working directly with you, we're not going to be charging for your use in your offices, your whatever way you're set up in your establishments across the country. I understand too, some folks are supporting schools. That extends to the schools that you're personally managing, not your school districts, but for some of you who actually manage and lead schools, you can use it there. Why are we doing that? Because in this case, you need that assistance just as much as the schools. And again, we understand the predicament of resources and time. So we felt that was the right thing to do, is to allow you to have that at no cost. So if you're interested in that, and this will be sent in an email to you, you can just email us and then we'll get you set up for you and your team within your office to use. If you want to share this out with your schools, or if you're a school who joined us for this call, what we're doing is we're going to give a 10% discount off of our already low cost to enroll your school. That means enrolling your students, enrolling your employees in the program. To give you a sense, our costs are about $1,000 to $2,500 for your average size school district, to give you a sense of what the cost of the program is on an annual basis. And that most certainly is truly dollars less than what is out there in the marketplace. Currently, they're anywhere from $1.50 or $1 all the way up to $5 a person. If you're looking for funding, CARES Act, state aid is definitely available out there. And then shortly, our friends in DC are supposed to be passing a stimulus package that currently has $320 billion in it for programs like this for schools. So that will be another source if that is needed. I want to let you know that we're going to provide you, if you choose to say, hey, this is a great program, and for those non-school folks here in the audience, if you want to pass this along to your districts, we'll give you an email template letter to send out, cell sheets, the presentation, if you want to share it with them. And that will be emailed to you over the next 24, 48 hours so you have it, along with this presentation, the video of this presentation, if you would like to share it with them, because this is all about access and awareness that a program exists like this. So we're really trying to push it out to let folks know, hey, we got a turnkey solution for you. So that's the program in a nutshell. And what I'd like to do now is take any questions that you may have. I know some folks may have submitted some stuff on chat, so I'll go back to John to see what he may have for us. Oh, you're muted there, John.
If you have questions at this time, if you will, just unmute your microphone, do it better than I did, and go ahead and ask questions. This would be a good time to do it. If you have any questions about your ESA usage or school district usage, anything you have, fire away while we have the experts with us.
Well, I love this. So nothing on chat, nothing on questions. So I'm hoping that means that we've done a good comprehensive job of explaining what the program is and how it works. But as I always say, you know, sometimes it takes a little bit of time to digest and come back. So the emails are in there that we shared with you. And like I said, we'll be following up with you with this presentation and other pieces. So should you have any additional questions coming out of that, please reach back. We're happy to get back to you quickly and give you whatever information that you need to make a decision for yourselves or to make a decision on behalf of the districts who you help support.
Tim, Carrie Ackerson asked, what about people who don't fill out the screener?
So if you don't fill out the screener and you're already registered, then the school will be alerted and they'll be able to follow up just as they can on Do Not Enters with going into the dashboard. It's truly as simple as hitting one button that then puts to the top of the dashboard those folks who haven't screened that particular day so that you can follow up with them, or you can be looking out for those students who may be coming in to intervene and make sure that they've taken the screener.
Other questions? We don't want to cut this short. We've got a little bit of time left, so other questions? If not, you know how to get in touch with AESA now. Tim gave you the email address to be able to reach out to, but if you need anything, please reach out to AESA. We'll make sure we get you in contact with Tim and the team as well. Again, AESA is so fortunate to have business partners like STOPit Solutions. And Tim, thank you so much. I mean, it's a great tool for ESAs to use. And I think once they do that, they'll be able to see what a great tool it is for their districts as well. And so thank you for making that offer to our members. We think that's fantastic, and best of luck with this moving forward. And to all those listening, thanks again for being with us at AESA.
John, I'm sorry, there seems to be another question about, can a child over 13 be a self-screener, or would this district decide how old the child has to be a self-screener? Would no children be advised to be self-screeners?
Yeah, that's a great question. So our experience, and I will say it could always be exceptions, but our experience is when schools do set up their student directory, parent directory, guardian, caretaker that works with that child, that the email is going to the parent first. And in most cases where we see a child, where the child may be contacted, it's typically their senior year of high school once they've turned 18. Some school districts do have a hard and fast policy of reaching out to the child to say, okay, you're 18. Are you going to be taking over this responsibility? Otherwise, 99.9%, it's still going to the parent guardian for them to manage it. I will state this, when the parent does register to get the screener, they do have the option to opt in their child to receive the entry pass once they've taken the screener. And to help us with FERPA, we have a box there where the parent checks it to give us permission to send that information to their child, because then they can open it up and put it on their phone as they walk in the front door.
Thank you again for the free version to ESAs. Certainly, we want to be able to tell all of our customers that we're doing everything we can before we send people into their schools. And so I appreciate that.
Absolutely.
That's a good point, Carrie. The idea of making sure our client districts are knowing that we're doing all we can on our side as an ESA, that's a great point.
And we're serving over 125 districts, and they all have different policies. Some are taking temperatures, some are, and so if we can say, this is what we're doing, is this satisfactory to you? We'll do it every day. You know, that helps.
Absolutely.
Very good.
John,
Like
There was one more question.
there's another question.
Oh, okay, good.
The question was kind of a follow-up to your last comments about the child over 13. It says, what child privacy protection laws are covered by the app besides FERPA?
Well, of course you have HIPAA. So if you're reporting on the health status of a child or even an employee, we need to keep that information, of course, secure. We need to make sure that that information is not mixed with the personnel file of an employee or a student file of a student. So we follow those regulations extremely closely for the obvious reasons of protecting an individual's health status. So that's where we fall, and that's why we chose to work this program through AWS as well, because they follow those same steps and guidelines, especially with HIPAA.
Good question.
Yeah.
Looking at the chat, looks like everything has been answered. Again, Tim, thank you so much.
You bet.
If you have any other questions, please don't hesitate to reach out to us and to Tim. And thanks again for the partnership. And thanks to all that joined us today. Have a good afternoon.
All right. Thanks, everyone.